Lockdown is nothing new for many disabled people. Many of us self-isolate each winter to avoid the flu. Lots of people had started to self-isolate or shield before the government even announced a national lockdown in March. And many of us experience our own mini personal lockdowns through recurring periods of illness. But this time was also different and frightening because disabled people felt abandoned and ignored. The lack of BSL interpretation for daily briefings, the lack of information in BSL or in Easy Read about the virus and prevention, the labelling of people as vulnerable, the lack of preparation to support people who employ carers or personal assistants. Then there was the coronavirus bill, the NICE guidance, the adding of DNR orders to the medical records of learning disabled people without any discussion or consultation. It was scary to feel that, on top of being ignored, disabled people now seem to be considered disposable. But disabled people also have a long history of coming together to support each other when social systems fail us. Even before the lockdown, deaf and disabled people had begun to organise online pandemic support groups, produced their own BSL and Easy Read information for each other, and were organising networks to share PPE for personal assistance. And then disabled people quickly organised to campaign against the new forms of discrimination by government and even supermarkets. In this context, it felt really important to come together to talk about our skills and our expertise. At a moment when 7 billion odd people nationally were panicking about losing their freedoms, we felt we had a lot of experience to share that non-disabled people could benefit from. So with some friends, I convened the coronavirus experts. I put the call out on social media and among friends, and 17 people came together in 2 online discussion groups led by and for disabled people to talk about what we had learned from our experience of being disabled by social barriers that was now proving valuable in coping with the pandemic. Our conversations were joyful, enthusiastic, intimate, and very grounded. We talked about our skills at adapting to living with uncertainty, at taking care of ourselves and looking out for each other, at being prepared for crises, for example, stockpiling food and even medicines and treats, and in emotional resilience, and much more. We didn't kid ourselves that it wasn't all so hard, and we recognised that lockdown was creating new barriers, particularly for some disabled people. But the conversations gave us a chance to connect with each other and appreciate ourselves better through validating each other, and this at a time when we felt scared of being overwhelmed by a new tsunami of ableism and disableism. Afterwards, I put together the Coronavirus Expert zine. It's available online and as a downloadable PDF for screen readers. And I hope it will help people to expand their understanding of inclusivity and what it means to bring marginalised voices in to collective challenges. So where next? Coronavirus Experts is the first project of Living Together with Limits, an ongoing action research investigation that seeks to bring disabled people's expertise and resourcefulness to the creative challenges of tackling climate change. We know that disabled people know a lot about interdependence, care, and mutual support. And as a society, we're all going to need to know about these things if we're going to survive and thrive together in a world where resource limits are tighter.